Welcome to Quick Medical Review. In this episode, we're discussing angina. Angina is chest pain or discomfort resulting from an inadequate blood supply to the heart muscle, typically due to coronary artery disease. Coronary artery disease involves the narrowing or blockage of coronary arteries by atherosclerosis. Angina can be classified into three types: stable, unstable, and Prinzmetal's variant angina. Stable angina is predictable and usually triggered by physical exertion or stress, relieved by rest or nitroglycerin. Unstable angina is a more serious condition where chest pain occurs at rest and is a warning sign of a potential heart attack. Prinzmetal's angina, on the other hand, is caused by coronary artery spasms and occurs at rest, often in a cyclic pattern. The underlying issue in angina is myocardial ischemia, where there is an imbalance between the heart's oxygen supply and demand. In stable angina, this imbalance is often due to increased demand during physical activity in the presence of fixed atherosclerotic plaques. Unstable angina involves plaque rupture and thrombosis, which suddenly reduces coronary blood flow. Patients with angina typically describe the chest pain as a pressure, squeezing, or burning sensation, often radiating to the left arm, neck, jaw, or back. They may also experience shortness of breath, nausea, and sweating. During a physical examination, findings might be normal in stable angina, but during an episode of unstable angina, signs like distress, diaphoresis, pallor, tachycardia, or bradycardia, and hypotension may be observed. To diagnose angina, several tests are used. An electrocardiogram detects ischemic changes. Stress testing provokes symptoms and ischemic changes on the ECG. Echocardiography assesses cardiac function and detects ischemia, and coronary angiography is the gold standard for diagnosing coronary artery disease, particularly in unstable angina or high-risk patients. Managing angina involves lifestyle modifications such as quitting smoking, eating a healthy diet, exercising within limits, and managing weight. Pharmacologic therapy includes nitrates for immediate symptom relief, beta blockers and calcium channel blockers as first-line agents for symptom control, antiplatelet agents like aspirin or clopidogrel to prevent thrombus formation, statins to manage cholesterol levels, and ACE inhibitors for patients with coexisting conditions like hypertension or diabetes. In more severe cases, revascularization procedures like percutaneous coronary intervention or coronary artery bypass grafting may be necessary to improve blood flow. If left untreated, angina can lead to serious complications such as myocardial infarction, heart failure, arrhythmias, or sudden cardiac death. The prognosis for angina depends on the severity of the underlying coronary artery disease and the effectiveness of the treatment. Stable angina generally has a good prognosis with proper management, while unstable angina carries a higher risk of myocardial infarction and death. In summary, angina is a symptom of heart disease characterized by chest pain due to reduced blood flow to the heart. Management includes lifestyle changes, medications, and possibly revascularization procedures to improve blood flow and prevent complications. Prompt recognition and treatment are essential to improve outcomes. Thank you for tuning in to Quick Medical Review. Join us next time as we continue to explore important medical topics. Keep learning and providing excellent care.